Welcome to Healthy Buzz, the podcast for women who are craving honest answers in a supported community. Hosted by Brandy Homerding, a certified nutrition therapy practitioner who believes your body isn't broken, but the narrative around women's health is. Each week, we're diving deep into holistic health topics, challenging the one-size-fits-all approach, and empowering you to trust your own informed intuition. Get ready to feel seen, supported, and seriously informed. This is Healthy Buzz, where collaboration meets unfiltered transparency in women's health. Welcome to another episode of the Healthy Buzz. If the topic of cancer has ever felt like a dark cloud of fear of what ifs, today's conversation is going to be a breath of fresh air. Today, I'm joined by Dr. Meghan Zech of Pacifica, a naturopathic doctor specializing in integrative oncology. We're moving beyond the standard of care talk to talk about the body's terrain and even your nervous system regulation and how they are great tools for cancer prevention and resilience. Dr. Meghan is a naturopathic doctor with board certification in naturopathic oncology and a deep passion for integrative whole person wellness. Her journey in natural medicine began with a fascination for the healing power of plants and the interconnected balance of the natural world, a curiosity that led her from an undergraduate degree in architecture at Cal Poly to earning a doctorate at Bastyr University, following a 2-year residency in integrative oncology. As both a registered herbalist and integrative clinician, Dr. Meghan bridges the best of both conventional and natural medicine. She helps patients navigate cancer prevention, treatment support, and long-term wellness through evidence-based nutrition, herbal medicine, and lifestyle strategies. Her approach is grounded in meeting people where they are and creating personalized, realistic plans that restore balance and resilience. Welcome to today's show, Meghan.
Thank you, Brandy. Thank you for having me today.
So I would love to hear about your journey to becoming a naturopathic medicine doctor specializing in oncology after having this architecture background. Tell me more about that journey and the shift that you had.
Yeah, I think I was really interested in architecture graduating high school, and so that is the path that I ended down initially. And while I was there, I just kept coming back to, what can I do? Like, it's so fascinating to learn like how you could support your health through foods and nutrition and how different plants could actually help support different aspects of health as well. And I was just always finding myself drawn back to that, to the point where I was like, I just need to study this. Like, this is where I really want to be, and it was like forcing myself to be in studio and doing my architecture homework. And I was like, I just want to be reading about plants and reading about food and just like totally nerding out down that pathway. And so it took me a long time to make that jump, but once I did, I think that it has been a very rewarding process since then. So it's actually really interesting too to see where there's a lot of overlap in the world of architecture and health and even the plant world, and how there's so much interconnectedness in all of these three very separate spaces. So it's been a fun place to draw parallels, even moving further into the health sphere and further outside of the architecture sphere.
So what led you down oncology specifically when you became a naturopathic doctor?
It was something that initially I had no interest in pursuing. It was very intimidating, I think, to think like, how could I go in there with my plants and nutrition and make a difference in someone's life that is undergoing a cancer that's experiencing a cancer diagnosis. We had to take clinic shifts as I was going through school at Bastyr. And one day I decided to sub on the cancer shift and just see what it was all about. And I left that shift that same day and was like, there's nothing else I want to do. Like, it was just so powerful to see what we were able to provide for people that were still getting conventional oncology care, but also layering in these different layers of support that allowed people the opportunity to manage aspects of their life that were not being addressed from the conventional oncology side. Like, when we're talking about what's happening in conventional oncology, we see, we're addressing the tumor. Like, what can we do to get rid of this tumor? What can we do to get rid of this cancer? But there's this whole other huge piece of the body that I think sometimes, and not by anybody's fault, but it's just they're focused on this. And there's, what's happening to the mental emotional space, what's happening with nutrition, what's happening with maybe you don't even have an appetite. So there's, they don't even want to eat, or they're so nauseous that it's hard to eat. And those are all places that we're able to address. And we have the time and the space to address in the integrative oncology perspective. So yeah, I think it really allows us to support people from a different perspective while they're going through treatment, or once they're done with treatment, where they don't have that, like cancer patients don't have that same level of support from the oncology team. There's still so much that we can do to help people regain that health in the post-treatment setting too.
Yeah, amazing. I love that you are pointing that out, that sometimes somebody who has like a cancer diagnosis, the tumor becomes its own world and they forget about the person that is actually around the body that is there as well, and all the different parts of that treatment and how that affects the whole body, not just the tumor itself. So it's like bringing back the person into the healthcare setting.
Yeah, exactly. Yeah.
So, when people think about oncology, they sometimes can have like this immediate, like, oh, this is a scary thing. And maybe it's a very sterile environment. And like we just said, it can be very like isolating. So, how is integrative oncology shifting that experience? How is integrative oncology like complementing both the conventional world through prevention, treatment, and survivorship rather than being an either or choice, but making it be like, this is part of the plan?
So people oftentimes come to me either with a brand new cancer diagnosis or a partway through treatment or 5 years after treatment. There's a lot of different stages that I see patients coming to me. Maybe they have a BRCA mutation or some other genetic mutation that increases their cancer risk, or even just a strong family history of cancer. So there's a lot of different places where integrative oncology kind of falls into the oncology world. We can start to address cancer risk before we're seeing a cancer diagnosis, which I think is very different from what is often the more standard of care oncology approach, where people are getting a diagnosis and then they're receiving treatment. When people are actually in the treatment phase, that's where integrative oncology really starts to help focus on how to support these more, I don't want to say auxiliary, but some of the things that are considered more secondary to the cancer treatment. Like how can I help someone feel like they're getting the nutrition that their body needs, or they're feeling well enough to actually move their body? Because we also see, data coming out that says like people have better outcomes when they're able to maintain some level of physical activity throughout treatment. But if people feel so terrible that they don't want to move their body, they're not going to want to feel like getting up and going for a walk or getting out and moving their body. So helping people to feel like they can maintain that quality of life as they go through treatment, or prevent certain side effects from developing. Like a lot of times with chemotherapy, we can see something called peripheral neuropathy, or just, really nerve pain and numbness and tingling that is secondary to the cancer treatments. And there's things that can be done during and immediately after cancer therapy is completed that can help decrease the risk or help resolve those symptoms if they do develop. And so then people are able to maintain their mobility or maintain their ability to, want to go out and be physically active, because it's not painful or difficult to walk in the long-term setting. I think nutrition is another huge piece that can be really supportive throughout this entire phase. And maybe when people are talking about like preventative care or recovery care, the nutrition conversation really, really changes compared to what we might be focusing on during active treatment. But there's all of these different levels of guidance that can be really supportive of just maintaining a baseline level of health and helping people feel more functional and feel more like themselves as they're going through each different phase of treatment.
Can you talk a little bit more about the survivorship aspect of cancer? Because I don't think that that really gets enough quality airtime. I feel like it's kind of like people are talked about the support that they get during their treatment, but there's not really talked about the support after they have overcome their cancer.
Yeah, and that's actually a space that I've been moving a lot more into over the past few years, because I have seen that there seems to be not a disconnect, but just a bit of a lack of support once people are done with treatments. Like, all right, great, you're done. Your scans are clear. We'll see you back in 6 months, or we'll see you back in 12 months. Great job. And one of the things that I've seen happen a lot of times for patients is that there's like an anxiety that develops around that, because all of a sudden they had people looking at them, very frequently, or following up with them very frequently. And now it's just like, all right, your cancer's gone. We'll see you in a few months. And they're just sent off with, nothing else to do to support their health in the interim. And, maybe they've got a handful of side effects that they weren't dealing with beforehand, or maybe their digestive system is all off because of some of the treatments they received. And now they're dealing with difficulty with bowel movements or gas and bloating, where they didn't used to have that. And What I've also seen is when these patients end up back in the primary care sphere, the docs are like, well, you had chemotherapy. That's probably from that. Go back and talk to your medical oncologist. And then they get bounced back to primary care because medical oncology says, well, you're done with treatment. Go back and see your primary care doc. And so I think that the group of us that are trained in this integrative oncology sphere have a unique level of support for these patients because we understand the treatments that they went through. We understand the potential long-term effects. Like that's what my practice is focused on. And so now I can translate that to helping people find ways to recover in that longer term setting, but also looking at some of the data around, what helps prevent that recurrence risk or decrease that recurrence risk, and how can we implement strategies beyond chemotherapy, beyond radiation, that are known to decrease risk of a cancer recurrence in the future.
Such a needed niche area. I'm really glad that you're doing that and providing that support, because I feel like that is wildly underutilized. And if more people knew that people like you existed to provide this survivorship, I think there would be totally different outcomes afterwards that people are and what they're experiencing, to have that sounding board and resource to go to who can understand and help them navigate the next steps.
Yeah, I think finding the outreach to patients has been an uphill battle from within our community as well, just finding ways to connect into places that just don't know that we exist.
Hey, Healthy Buzz community. Have you been curious about using a continuous glucose monitor to unlock powerful insights to your metabolic health? Imagine seeing in real time how your body responds to different meals, different workouts, and also the effects of stress. Now, what if you could experience those benefits without being locked into any type of recurring subscription like some of the other continuous glucose monitor programs out there? With my Blood Sugar Savvy course, you'll get exactly that. You'll receive access to 7 engaging learning modules, 2 continuous glucose monitors to start your wellness journey, plus 4 weekly one-on-one video strategy sessions with me where I'll personally guide you to understanding your CGM data. We'll work together to identify your unique blood sugar patterns and create customized strategies for better energy, mood, and overall well-being. Oh, and by the way, this is especially crucial during your peri- and postmenopausal years. Blood Sugar Savvy is about understanding your body on a deeper level, implementing practical strategies, and gaining sustainable knowledge to support your overall health and wellness. Ready to get blood sugar savvy and take control of your metabolic health? Healthy Buzz listeners can save $30 simply by using the code BUZZ at checkout. Your personalized blood sugar journey starts now. So you kind of talked about this a little bit, about thinking about the things that we can do that maybe is decreasing cancer risk and recovery. And I think that you kind of talk about the body's terrain. Can you share a little bit more about different aspects of the body's terrain that may be increasing risk and maybe inhibiting a good recovery?
To really back it up and start from just a baseline space, is that I don't think of, and from the perspective of integrative oncology, we don't think of cancer development as a one-step process. It's something that's happening slowly over time, and there's a lot of different influences that are playing into that. And that's where we're seeing things like chronic inflammation, exposure to environmental toxins, metabolic dysfunction, infections, imbalance of hormones. All of those things on some level can influence the health of cells and the ability for them to communicate effectively. And if we're seeing this chronic level of inflammation, of low level inflammation, or just insults to the baseline functioning cells over a longer period of time, that increases the risk that some of those cellular processes just aren't functioning the way that they should be. And they're losing the ability to kind of weed out the cells that are not normal cells, that are the potential cancer cells, the precancerous cells. And if we don't have the ability to weed those out, those cells also have more of a risk of developing into a cancer over time. And that's where some of these more lifestyle factors can have a really strong role. That's things that are going to falsely stimulate growth signals, like imbalances of hormones like estrogen and insulin, or if we're seeing chronic levels of stress that are suppressing the immune system function, or poor sleep that's also affecting immune system function or immune surveillance. Those are some of the more baseline things that I think of as being able to support a reduced cancer risk. Also, nutrition is going to play a huge role in there as well.
Can you elaborate on that a little bit more about the role nutrition plays on somebody's diagnosis, prognosis, and kind of the slow burn that happens with these cells becoming a little bit mutated because of all these different things that you just mentioned that can influence that? And it's kind of okay, what role is nutrition impacting that?
Sure. I think nutrition is it's one of the most fundamental pieces, but it's so multifactorial because of that. Because, we're looking at like, are the cells getting the nutrients that they need to be able to have the healthy communication and healthy reproduction? Or are they malnourished? Is there a lack of like hydration is a huge one too, just for the function of the immune system overall? Are we giving the body the nutrients that it needs for adequate immune function in general? And then are we providing an environment that's going to be more pro-inflammatory because of some of the foods that are getting introduced to it? Or are we, is there a more anti-inflammatory dietary approach that's actually helping to decrease some of those factors? Cancer thrives in a pro-inflammatory environment. It gets more of the nutrients that it needs to have. There's more risk of cellular damage because some of the waste products that it's exposed to. And so being able to support that anti-inflammatory diet through the food choices that we make plays a really huge role. And then another place that I think is really, really important is what nutrition's effect on the microbiome can be on the gut health, because gut health is another one of those cornerstone pieces as far as like how well the body is able to respond to invaders and respond to aberrant cells and support immune function and support hormone balance and a lot of the things that start to play a role in, again, coming back to some layer of that cancer risk can be regulated from the gut health as well.
Yes, I agree. Like the nutrition piece is obviously a part that I'm very passionate about and helping clients understand. There's so much noise around like diet culture and like what we should be doing and shouldn't be doing when it comes to fueling our body. And we've gotten away from like the foundations of what nutrition is really about and try to out diet our diet, I guess. Like we're trying to manipulate too many things sometimes. And I would love to know your take as an oncology focused naturopath around sugar, because there is some conversations around sugar in cancer and tumors, and I would love to hear your take on that.
Sure. This is a conversation that I have very, very frequently. I feel like it's definitely a big question that comes up. I like to think of foods in moderation. I think of anything in moderation is probably better than anything to an extreme, and sugar falls into that realm as well. One of the things I talk about a lot of times with my patients is it's not so much about like pure avoidance of sugar. When you're doing that, you're missing out on a lot of really important nutrients because people start cutting out like fruits and vegetables and a lot of the produce that's really important as well. And I look more at like, what does your fasting insulin look like? What does your hemoglobin A1C look like? What are the patterns of sugar in your body versus what is it happening because you went to a Christmas party last week and indulged in some treats? And I think that's a really important thing for people to remember, because I oftentimes have patients showing up that are, on these very extreme versions of like ketogenic diets. And there's a lot of nutritional imbalances that I think that can be born of those things as well.
Yeah, I think a lot of the metabolic dysfunctions that we see are also that slow burn process, right? It wasn't just the one holiday party that you went to and you had more cookies and candy, but it was like over time, the consistent exposure maybe to sugar, and that it wasn't really consumed in moderation. And we weren't also balancing it out with proper nutrition that then leads to the blood sugar dysregulation that we can see.
Yeah, yeah. And sugar definitely has, its impacts. Like too much sugar is going to throw off your gut microbiome. Too much sugar is probably going to be more pro-inflammatory. It's going to cause imbalance in some of the hormones that we talked about. And so I think it's not just like, did I have sugar or not, but like, what is it doing to all of those systems? And if we start to see it affecting any of those systems, then it's something that's worth coming back around to and reevaluating.
Yeah, for sure. So I think that leads to the next point that I want to talk about is like we often think of cancer prevention as a list of things that we need to restrict, but I know that you really like to focus on rest and nervous system regulation for key tools. So why is a regulated nervous system so critical for cellular health and building long-term resilience?
Oh, a few things. Chronic stress, that's going to be a really powerful driver for an imbalance in hormones again. So we start to see a lot of things getting thrown off. We also start to see increase in inflammation. And it's this persistent activation of this over elevated stress response that starts to break down that immune surveillance and cause disruptions in your blood sugar regulation and increase that inflammatory state where we want the opposite of all of those things, right? We want to be able to promote that cell health and DNA repair so that we reduce the risk of those cells turning into a potential cancer cell. And that's where things like regulating the nervous system, supporting vagal tone, practicing things like mindfulness or breath work or getting outside for a walk or, utilizing herbal medicine in those settings sometimes as well, depending on what is needed to support, can be really powerful tools. We see an increased risk of certain cancer types when there is a very flat cortisol curve. And, that's something that I think is worth pointing out, because either we can see like that chronic stress is usually what's truncating that morning cortisol awakening response. And when we start to see that flattening out, it's usually because people are continuing to push through things thinking like, I got this, the resilience is strong, and resilience is really strong. And I think that can be a very supportive thing for periods of time. The problem is I think we get used to that level of stress, and then we push ourselves to the next level of stress and the next level of stress. And I think, I know I'm guilty of it. I think it's really easy to do because you just normalize it as you go through from one stage to the next. And that starts to disrupt a lot of things. It disrupts hormones, it disrupts sleep. Sleep, it's another really important piece in the foundations of how to prevent cancer or to help prevent cancer, I would say, is the repair and toxin removal that happens during that deep sleep. And if we are chronically stressed and dealing with cortisol dysregulation, then that's one of those things that's probably going to be affected by cortisol being all over the place.
Yeah, it's so interconnected. Everything is so like, is it the cortisol being just up that is causing you not to sleep well? That is then causing more stress on the body. Like it's so interconnected, and people can kind of not realize the vast importance of like all of these things, because it can feel a little overwhelming sometimes to be like, oh, I have to sleep more and I have to manage my stress. How can I manage my stress when we live in this really fast paced world and a lot of things feel like the world is on fire right now? And it can be really hard to navigate that. But I think what I'm hearing is that you are offering a lot of the tools for, here, let's ground yourself. Here's how we like evaluate what your stress response is. And do you have any coping tools in your basket of like, help me out?
Yeah, and actually there's something that's been coming up for me more frequently recently, is just the idea of ritual. And I think ritual is such a powerful tool that doesn't have to add more stress to how we can address some of that heightened stress response. Because ritual, it's an opportunity to incorporate something that doesn't have to be complicated. It can be a very simple tool that we can use on the day-to-day. It can be a structure that the body learns to rely on, that says like, this is something I come back to frequently, this is a safe space. And it starts to tell the body that like, while this is existing, this is something that I can rely on. And in that space, your body learns that it can shift back into that parasympathetic or that like restorative state, versus just chronically existing in that hyper reactive place. And I think that that's where incorporating a lot of these things, like the breath work that I mentioned, or a cup of tea, and just sitting down with a cup of tea and looking out the window can, that can just be 5 minutes of your morning. It doesn't have to be a big elaborate thing, but having that as something that you can come back to every day or 6 days out of the week, I think can really help to start shift the nervous system. And in shifting that nervous system back into the parasympathetic more frequently, it starts to tell the body that that is, a normal place to exist, and it becomes easier. It's creating a path, and the more we walk down that path, the easier it is for the body to remember that it can also flip to that side as well.
Mm-hmm. It's so important. I mean, I work with a lot of women who are very type A and very like high achieving, and I love them for that. But also, they've gotten to the point where they're like burning out and their cortisol is maxed out and they're sleeping like shit. The state of health is kind of lacking sometimes. And once we start recognizing that and like pulling back and zooming out and being like, we need to create some boundaries here. There's one client, I'm like, I think you are addicted to cortisol. You are addicted to this like high that you get from like all the notifications and the meeting requests and saying yes and being that go-to person. And like, we need to say no to some things. And since she has started shifting that, she's like, oh my gosh, like I'm starting to sleep better. My body is less inflamed. I'm less bloated. I'm like, right, creating some boundaries and creating some rituals around like stress. Which, if you heard Megan, she did not say that you're going to sit and drink your cup of tea and scroll on your phone. You're going to sit and drink your tea and look out the window. So even taking times, like sometimes that's my assignments for my clients. I'm like, I need you to sit for 1 minute with no distractions in silence. Start with 1 minute. We're going to start with these baby steps, because when you first do it, your brain is going to be like, what are we doing? We have this to-do list. We have all these things we need to do. And you're going to be like, but no, I can do this for 1 minute. And then we increase to 2. And then pretty soon you have like an hour of time where you have like done some grounding and like reset your nervous system.
Yeah, and I mean, I think that's a really good point. And you brought something up too about like the to-do list. And I think it's useful to point out that to-do lists can become addictive too, because when you cross something off your to-do list, you get that little like hit of dopamine and you're like, yay, I did something. And then that feels good and you want to keep doing it more. Although it's feeding back into that stress promoting cycle. And there's another thing that I was thinking of when I was like thinking about coming in to talk on this podcast today, and is the concept of glimmer. And glimmer is something that came to me the other day in an email, of glimmer being those like small twinkling moments that bring a sense of joy or a sense of ease. And I think that can also be something that allows for that little hit of dopamine to come and make us feel good. So, the opposite of a trigger. And I think identifying and knowing about your triggers is really, really important. But there's also something incredibly healing to being able to slow down and noticing just those like glimmer moments in the day. And maybe your goal for the day is to collect 5 glimmers and just be able to be aware enough to see those things and remember and reflect on them. And I think that can also help to shift the body into more of that like calm and kind of state of awe, I guess.
Yeah, yeah. I mean, it feels so scary sometimes at first to be like, I can sit and rest and not have to do and mark everything off the to-do list. What if you just like threw your to-do lists away? But what I like to teach my clients is something called do, ditch, defer, delegate. What do you actually need to do on that list? What can we defer to another time, another place? Maybe this week is not the week that you're painting your bathroom before the family comes for Christmas. Like, maybe that's deferring. Maybe we're ditching when actually we do not need to do this. And maybe we need to delegate. Maybe we need to hire somebody to paint that bathroom. Maybe we need to hire somebody to clean our house. Maybe we need to hire somebody to do the grocery shopping and the meal prep. Like, if we start implementing some of that, it can really help with the stress and the to-do lists. So you can feel a little bit more in control, because a lot of times we have these lists because we feel a little out of control in different areas. And so the more lists and to-dos we get done, we feel like we're in control, and it's not creating that. So I would love to hear a little bit more about the role that environment can be playing in the terrain of their body and the different systems. How can environment be impacting them?
Yeah, environment can be impacting from a whole bunch of different ways. Like we can be talking about exposures. Are you living in a house, for example, where there's somebody smoking? Are you getting secondhand smoke? Are you smoking yourself? Like what's coming into the body by way of like toxic exposure? Or is it a house that's infected by mold and there's a low level of inflammation because your body is chronically fighting off what it is recognizing as an infection, and that's just not going away. So there's that, like physical environment surrounding you, what's happening and how is that affecting your body. There's the environment from the standpoint of like xenoestrogens and estrogenic exposure that's also, potentially having a negative effect on the body, not necessarily phytoestrogens, but from the xenoestrogen exposure standpoint. And how is that disrupting the hormone signaling within the body, and how is that increasing risk for particularly hormone sensitive cancers? And then also, like, what does the mental and emotional and spiritual environment look like? And how is that also affecting health, and playing back into that conversation we just had around like stress and cortisol? And is that affecting sleep? Is that affecting mood? Like, all of those things are going to also have a downstream effect on chronic inflammation, or if you're like chronically stressed or depressed, or feeling really anxious, that's also going to affect how you're digesting your foods. And if you're not digesting your foods effectively, then we're talking about, poor absorption of nutrients or potentially disruption in the gut microbiome. So now we don't have as healthy set of bugs in the gut. Like I feel like they all, like you said earlier, they all connect back to each other in some form and all start playing back into some of those more core pieces that we talked about.
Yeah. So it sounds like there's just not one thing that can increase your cancer risk or help with cancer prevention. It's multifaceted, and it's realistically a holistic approach to your health and wellness when we think about that.
Yeah, I think like when you talked about on the survivor stage, I think it can be really helpful to look at them from like, okay, what does like your mitochondrial health look like? What does your digestion look like? What does your environmental exposures, and how well are you detoxifying from those exposures? Because that's another piece that I didn't really touch on, but like maybe you're exposed to these things, but how well does your body handle them once your body's been exposed? And how well is like the resilience piece? Like, how are you managing stress? Like, how is that affecting your sleep? How is that affecting your hormone balance? All of those things are, I think, different pillars essentially that we can look at and try to improve on each different sphere, and in helping to prevent that recurrence, or also just support health overall.
Yeah. So when we talk about detox, I want to talk about that a little bit more. Detox in like the wellness world can be really noisy. And there can be all these fad things that tell you can support detoxification. But from an integrative oncology perspective, what are the things that you're looking at when it comes to detox, whether nutritional habits or maybe some herbal remedies that you are helping with your clients to not only support their detox pathways, which we can talk about, which the detox pathways are, but then also to help them maintain those open detox pathways.
Sure. When I'm having this conversation with people, I'm starting with the foundations, like what are your detox pathways? And primarily looking at like, are you pooping every day? Are you peeing? Are you staying hydrated and peeing? Like, are you sweating and are you breathing? Because those are the four main places that I want to look at. And if any of those are not being addressed, that's, the first place that I want to dive into. But then also looking at from like the liver and kidney standpoint, like what can we do to support those pathways? Are we feeding the body things that are going to detract from the health of the liver and kidneys? So are we having a diet that's really high in processed sugars or simple carbohydrates or saturated fats? Or are we feeding the body diet rich in like phytonutrients and fiber? And I was having this conversation recently with another naturopath friend of mine, and we came to the conclusion that the answer to everything is fiber in the end. Like fiber
I
touches
love
on
that.
so many different aspects of health. Like it helps with blood sugar regulation, it helps with detoxification and binding and getting all of these things out of the body that we don't want anymore. We help with regular bowel movements, it's going to help with,
Cholesterol.
yeah, there's just so many different spaces. Like it's going to help with hormone balance. Like there's just so many spaces that fiber hits on the spectrum of health that I feel like, when I'm starting people and just like very basic, like what can we do to help you feel better? Like let's hit that fiber goal, and let's not like halfway hit that fiber goal. Like let's really go for that, 25, 30 grams of fiber a day. Not straight out the gate, because I've definitely seen people try to do that and that doesn't make anybody feel good, but gently increasing to that range and then staying there, because I think that really helps with supporting many of those detox pathways specifically, and also shifting hunger signals enough that people are able to make more conscious choices around foods versus just getting extremely hungry and just reaching for the first thing that's available.
Which that also sends your cortisol when you're in the hangry mode. You're not going to be a friendly person. Your cortisol's going to be shooting up. And with the fiber piece, can you tell our listeners a little bit more about like what does happen if they increase their fiber too quickly, and what are some good sources of fiber that they can start exploring?
Sure. So when I see people just going like straight at like getting a fiber supplement and just going like full dose right away, one, I see a lot of gas and bloating. And the gas and bloating should be a transient thing, but basically the bugs in your gut are starting to learn to digest a new food and they're creating more gas. And as they learn how they want to be digesting that food, they over time get better. But if you just like throw that all at them all at once, usually it's something that ends up with a lot of digestive distress. It also can shift bowel movements to either constipation or diarrhea, just depending on the type of fiber that people are choosing to use or how well they're staying hydrated. And I think if you're going to be increasing fiber in any form, always, always, always pay attention to how much you're hydrating as well, because those two things go hand in hand for sure. Fiber types that I recommend, there's a couple of really interesting studies out there that looked at just the diets that people follow and how that affects microbiome. And I think that's another piece that I didn't mention before about what fiber can do for the body, but fiber really, really can support like a healthy microbiome environment. And what these studies showed was that people that were eating less than 10 types of produce a week had much less diversity in their guts than people that were eating 30 plus types of produce in their diet. And it's always produce that we're looking at in most of these studies. And 30 different types of produce to me sounds like a lot. Like I'd go to the grocery store and just buy up every vegetable if I was trying to do that.
Right?
And that doesn't always seem very realistic either, because what are you going to do with all those vegetables? Half of them are going to probably go bad. Like I think unless you're able to go every couple of days, finding kind of tricks to how you can get more produce in is a really useful foundational recommendation. And one of the things those studies also included was herbs and spices. And so that's where I think you can have a lot of fun, is figuring out like, oh, maybe I can throw some, cinnamon on my oatmeal and have also the anti-inflammatory and antioxidant effects from a lot of these herbs and spices out there too. But those are going to count into that total goal as well. And then every time you go to the grocery store, try to find a new fruit or vegetable that you haven't tried before and incorporate, but just one or two. Don't try to go like the whole entire produce section. And then shifting as the seasons go. I think that's a really helpful thing too, is just like as the seasons change, try to find some of the fruits and vegetables that right now, citrus, oh my gosh, like a grapefruit in December is the best tasting thing in the world versus, and the satsumas. Like I think those are some things that are like my absolute favorite right now. Whereas in the summer, I'm all about, the berries and the apples in this fall. And from a fruit standpoint, the greens in the spring, I think greens in the spring are also a huge, huge support for detoxification too. So I think that's a really helpful thing. When we're eating with the seasons, we're also supporting our body's needs as the seasons change too.
Yeah, I love that. It's a great reminder that go visit your local farmers market, support our farmers, see what they have. And like, that's a great way to also like start trying new foods. Be like, oh my gosh, I've never had asparagus before or kohlrabi before. And you can grab that, find a recipe and start experimenting with a new food. It's a great recommendation.
Oh, funny. I was thinking kohlrabi too. When you it's about kohlrabi, but apparently.
It's such an unsung little, I forget about it all the time. And I need to remind myself to next time at the farmer's market, because that's usually summer that kohlrabi is, right? Yes.
One of the other things from a fiber standpoint, but also from a cancer prevention standpoint that I think of often are the brassica vegetable family. And the brassica vegetable family are a family of vegetables that just have a really good set of data behind them in the world of cancer prevention and what they can also do to help support detox pathways in the liver. They provide a lot of the nutrients that the liver needs to be able to detoxify efficiently, especially when we're talking about dysregulations in like hormones, estrogen and progesterone. Sometimes we'll use extracts of the brassica family of vegetables to get much more concentrated doses, especially when we're talking about different types of breast cancer or hormone related cancer. So prostate cancer is in there as well. But that plus some of your handful of berries, that's my number one recommendation to most of my patients, is like have a handful of berries every day. You're getting your antioxidants, you're getting so many phytonutrients. You can eat them fresh, you can eat them frozen. They still maintain a lot of that, the things that we're looking for. I don't so much recommend like the dried and powdered or like dried into basically fruit candy versions, because like a dried mango is just like candy. Just think of that as candy. Whereas when you're powdering them, you start to break down a lot of the antioxidant capacity that you would be getting when they're fresh or frozen. So I'd say brassicas and your berries, like your colorful berries, are two of the cornerstone pieces that I bring on board.
Can you tell our listeners what vegetables are in the brassica family?
So I think of like cabbage, cauliflower, Brussels sprouts, broccoli, bok choy. Bok choy is one of my, like, if you haven't tried it, go try it. Just like pan fry it. Tastes so good. One of my favorites.
Yeah, awesome. Everybody go pick up a new fruit or vegetable the next time you go shopping and let Megan and I know what you made. We'd love to hear. Okay, so I know that you really are an advocate of knowledge and knowledge as agency. So, how does understanding the why behind lifestyle choices like sleep and sugar and all the different things that we've talked about impacting inflammation? How can this help women step away from like fear-based prevention to a place of empowerment and the permission to trust their body? Because I feel like there's a lot of fear mongering out there. And, sometimes I feel like we like to stick our head in the sand and think that it's not going to affect us, that we're invincible until all of a sudden we receive a diagnosis of some type of health complication. And all of a sudden it's like, oh my gosh, fire bells, and I need to consume all this information. And we get mixed messaging. And so how can we avoid some of that fear mongering and be in a more empowering type of situation with the information we're consuming?
I mean, it really is so hard to sift through all of that information. And that, that's what I end up doing a lot of times with people, is like just breaking down like what is out there and is this really worth taking? And do you need to be on all 75 of those supplements? Answer is probably not. But one of the core principles of naturopathic medicine is docere, and it's to teach. And I think when people understand what the recommendations are or why those recommendations are helpful, it makes so much more of an impact, because it's, one, I think, motivating, because you understand what you're doing and there's more of a tangible reason behind it versus like, oh yeah, if you don't get good sleep, that's just not good for your health. Like it doesn't give a lot of context, and without that context, I think it's just really hard for people to want to hold on to these changes. Like, a lot of times I'm asking people to change their diet or change their lifestyle habits, and those are not easy changes to make. So allowing for that level of education, or like providing that level of education understanding, I think really helps to shift from like an empty prescription to something that is able to enhance health from a way that people can also take that away and understand what they're doing for their health. And I think a lot of these recommendations don't just reduce the risk of cancer, but they also reduce the risk of some of the other chronic diseases that are leading causes of mortality amongst Americans. Cardiometabolic health, so heart disease and metabolic disease, diabetes, all of those things are going to be affected by supporting many of these pathways. And so it's just helping to support a healthier life overall.
So let's say somebody is looking for a provider to help them on their journey, whether they want to be in a preventative state, they're currently going through cancer treatments, or they're in the survivorship stage. What should they be looking for in a provider? Are there specific credentials, or what questions should they be asking to ensure that they're getting the collaboration and science-backed care and not just some trend or flashy thing out there?
So among the group of the integrative oncology naturopaths, there's actually a board certification that you can achieve, that these providers can achieve. It's called a FABNO certification. It's Fellow of the American Board of Naturopathic Oncology. And you can search providers that have that credential through a place called the OncANP, ONCANP.org. And that is the Oncology Association of Naturopathic Physicians. And among that, there are people that have their FABNO certification. There are people that don't. But all of the people, for the most part, that are members of this organization have gone through training specific to cancer care in the naturopathic oncology setting. Cancerchoices.org is another place that is very rich with patient-facing materials as far as how to support your body during cancer, how to connect with different providers in the cancer sphere. And then KNOW, integrativeoncology.org also has a database of providers that are more focused in working in this corner of health.
Amazing. Are there any specific questions that you feel like are something that maybe somebody should bring to a consultation or even an appointment with any of these providers?
Well, in unlicensed states, so states that don't license naturopaths as a medical provider, there's no one regulating the term naturopath. So let's say you're in Kentucky, for example, someone can call themselves a naturopath and have done like a weekend certification online and become a certified naturopath, but they're not a naturopathic doctor. So I think it's really, really important to look for those credentials of, do they have the letters ND or NMD, which is like Idaho and Arizona have to use naturopathic medical doctor versus just naturopathic doctor. But it's state to state, so it really depends on what state you're in. You can always look up in your state if naturopaths are licensed in that state, and if not, just be cautious of what naturopaths you're working with if someone is calling themselves a naturopath. But again, that's where going back to those databases can be really helpful, because you have to have gone through the like 4 to 5 year medical training and supervised medical training at an accredited school to be able to be listed in any of those databases.
Okay. So yes, it sounds like you do have to do a little bit of research, but Meghan has provided some really great resources that we will link in the show notes. Now, let's say somebody wants to work with you specifically. How can they connect with you, and like what type of care are you allowed to provide?
So within the state of Washington, I'm licensed in Washington as a provider. I can work with you same as your primary care provider can work with you by choice. I'm not anyone's primary care provider. It's just not the type of care that I provide, but I am connected with a handful of great primary providers that are also, available for those services. But I focus more on like the cardiometabolic health, heart health, metabolic health, and cancer care and prevention, risk reduction. I do see patients through a clinic in Tacoma virtually. That clinic is called Puget Sound Family Health. And then I also see patients in person through a clinic in Ballard. That is Village Medicine.
Okay. And they can find all your information about how to connect with you as well on your website. And what is your website?
My website is santapacifica.com, and I also utilize that more as my like hub for cancer information, like what resources might be useful. I've linked a handful of resources out there, and then I also link back to my Tacoma clinic there as well.
Okay, amazing. We will put your information in the show notes, but thank you so much, Meghan, for this wonderful, enlightening conversation on a topic that can sometimes be a little fear-based, and so I appreciate your fresh perspective on it.
Yeah, thanks for having me today. It was fun to come in and talk with you.
Thanks for tuning in to another episode of Healthy Buzz. I hope this conversation has left you feeling seen, supported, and ready to take the next step in your health journey. Love what you heard? Make sure you subscribe to Healthy Buzz so you never miss an honest conversation. And if you found this valuable, please take a moment to leave a review. I truly appreciate it. For exclusive weekly tips and holistic strategies, be sure to subscribe to my weekly newsletter. The link is in the show notes. Remember, this isn't just nutrition, it's permission to trust your body. I'll catch you on the next episode of Healthy Buzz.